Hello friends, today we will discuss about complications of hernia. What are the commonest complications that may occur in a hernia? And by hernia I mean inguinal hernias and paraumbilical hernias. These are the commonest hernias that occur. Now the complications of hernia are basically three types, which are the commonest complications. Number one, the first and the initial complication is irreducibility. That means the hernia becomes irreducible. Now what does it mean? Initially, or the hernia when it initially occurs, it is reducible. That means that if there is an opening and from the abdominal cavity a hernia comes out of the cavity when the patient is walking or the patient is standing or the patient is straining. Now when the patient lies down, the contents come back within the tummy. So this hernia is reducible. Now irreducibility, it means that the contents come out of the opening when the patient is standing. Even when the patient is lying down, it does not come back. It is outside. That means it always stays outside. That means that the hernia is irreducible. And this is the initial starting of complications of a hernia. Now what is the second complication? The second complication is obstruction. Obstruction usually happens in intestine. It happens when the intestine comes out of the hernia and it becomes irreducible and the contents or the bowel contents cannot pass through the hernial defect, so it becomes obstructed. The patient in such cases usually presents with intestinal obstruction. That means the bowels or the intestinal contents cannot pass through the intestine. The patient has a tight abdomen, has vomiting and presents usually to the emergency. Such patients usually require an emergency surgery, which definitely is very dangerous and very life-threatening sometimes. So that is the second complication that may occur in a hernia. Now the third complication that occurs in a hernia, which is the most dangerous and the most life-threatening complication, is a strangulation. Strangulation usually happens when the hernia or the contents of the hernia is so much obstructed that the blood supply to the contents is totally lost. Because the blood supply is lost, the intestine may become gangrenous. That means the intestine becomes dead. If the intestine is dead, that requires an immediate life-threatening emergency surgery. If the intestine is dead, that requires to be removed, and we remove the part of the intestine and join the healthy ends together. So this is the most dangerous or most life-threatening complication of an inguinal hernia or a paraumbilical hernia, which is called strangulation. So basically, if you are delaying hernia surgery, or if you are waiting for a hernia surgery, or if you are planning a hernia surgery at a later date, it is important for you to know what are the possible complications that may occur in a hernia, so that you can plan your surgery early, or you can plan your surgery before such complications may occur.